Pembetulan sedikit ya, saya telah pun berpindah ke KK Gombak Setia. So for now, I'm one of the FMS in KK Gombak Setia. So izinkan saya untuk bercakap dalam Diwi language kerana usually kita punya audience adalah daripada segenap lapisan. Okay, so next. So these are the outlines of my presentation. We will start with definition of wound, stages of wound healing, and management strategy for wound care in primary care. Okay, so apakah itu wound? Wound is a disruption of the skin integrity, mucous membrane, and organ tissue. And usually, it will end up with disruption of the structure and also function. Seperti yang kita lihat ya dalam gambar ni, kita tahu skin ada 3 layer. There's an epidermis, dermis and also hypodermis layer. So the deeper the wound, usually the more difficult to heal and more challenging to manage. Okay. So, upon wounding ataupun apabila berlakunya luka, automatically our body akan activate the cascade of cellular event to heal the wound. So, maksudnya badan akan berusaha untuk repair the wound and fill the gap of the wound with the new tissue. So ada 4 fasa iaitu hemostasis, inflammation, proliferation and remodeling. And fasa ini berlaku secara overlapping. Okay, so fasa yang pertama adalah hemostasis. So just imagine when you have a wound ataupun berlakunya luka, automatically body akan cepat-cepat berhentikan luka tu supaya tidak berlaku pendarahan yang berlebihan. Okay, so usually yang ini berlaku immediately and will last about few hours. And subsequently, the wound akan masuk ke dalam fasa inflammation ataupun inflamasi. Okay, fasa ini sangat penting. Pada waktu ini, blood vessel ataupun salur darah akan mula mengembang, especially dekat kawasan yang ada luka tu. Jadi, blood vessels ini akan menjadi telap dan sel darah putih as the first enemy, kita punya army will go to the wound area. Okay, so our neutrophils ni, okay, dia dah keluar. Dia keluar bersama dengan cecair daripada ataupun plasma from the blood vessels. That's why in clinically, dari segi mata, dari pandangan kasar kita nampak luka itu akan berair. So apa ada dalam air tu ataupun acidic tu adalah yang pertama adalah neutrophils, our first army. So these neutrophils akan kill all the bacteria and pathogen at the wound bed. Okay, it will clean the debris on the wound bed. At the same time, later macrophages akan will go to the wounding section, and this macrophages is like our alarm flora, di mana dia akan bersihkan kawasan luka tu. Dia akan makan all the dead bacteria, it will makan the neutrophils and also all the slough also. Okay, and then at the same time, there will also secretion of the inflammatory cytokines and also growth factor during the inflammation. Okay. So when the inflammation settle, and then soon the wound will go into the proliferative phase. And during the phase adalah fasa di mana akan berlaku angiogenesis. Maksudnya akan ada salur darah baru yang timbul ataupun terbina di tepi-tepi di bahagian luka tersebut. Kerana pada waktu ini angiogenesis ni akan membawa segala growth factor ataupun gist-gist yang diperlukan untuk berlakunya wound healing. Okay. Selain daripada fungsi proliferatif iaitu fungsi penghasilan tisu-tisu baru, ada sentang berlaku re-epithelialization di mana tisu luka itu bukan sahaja akan tumbuh daripada bawah tetapi daripada tepi ianya akan berlaku re-epithelialization, maksudnya dia akan makin mengecil daripada tepi dan akhirnya tertutup. Okay. And lastly adalah fasa remodeling. Seperti kita tahu, tisu-tisu baru ni sebenarnya sangat fragile ataupun sangat lembut. Oleh itu, sewaktu fasa remodeling, kolagen yang berada di dalam tisu-tisu baru itu akan menjadi lebih kuat supaya luka itu menjadi lebih tough, supaya dia tidak mudah pecah semula. Alright. So, ideally we want like this. Maksudnya luka yang macam ni dia dah cantik dan akhirnya dia patut melakukan proses penyembuhan luka sehingga sebegini dan akhirnya tertutup. Tetapi dalam kehidupan, everything ada challenges kan. Termasuklah kita punya management of wound. Selalunya problem kita di primary care adalah to manage chronic wound. So chronic wound ni adalah apabila wound tu selalunya stuck waktu inflammatory dan proliferative phase. Jadi menyebabkan wound itu tak dapat tutup. Dalam masa yang sama, the epidermis, daripada kawasan tepi ni fail to migrate dan maka wound margin ni tak boleh tutup. Okay. So, menurut study ada few reasons kenapa kita fail to manage chronic wound dengan cara yang baik. Pertama adalah wrong diagnosis. Nombor dua adalah inadequate wound bed preparation, presence of infection or inflammation. Nombor tiga adalah improper treatment. And lastly, lack of holistic care and also patient-centered care. So, with this, what should we do? As a primary care practitioner, what can we do to help our patient? So there are few management strategy. Okay, okay, let's go one by one, inshallah. Okay, the first is to confirm the etiology. This is very important step. So as a primary care practitioner, we have to get a good history from the patient. We have to know how patient develop the wound. Macam mana dia dapat wound tu? Dekat mana? Apakah treatment yang telah dia dapat sebelum ni. And then we have to know what are the comorbidities of this patient. Does this patient has hypertension, diabetic? Adakah patient ni ada bedbound, ada history of CVA? And then we proceed with the examination of the patient and also the wound examination. And then we have to do the relevant investigation such as mungkin FBC, LFT to see the albumin, and also the X-ray if indicated. And lastly, we have to achieve the diagnosis. Okay, so we have to know what are the possible diagnosis of the wound. Is it a venous ulcer? Is it a diabetic foot ulcer? Is it a malignant ulcer, burn, neuropathy, or might be ischemic or arterial ulcer? Okay, this is very important supaya kita boleh manage the patient according to the underlying problem. And from the history juga, we have to identify what are the systemic factors that might hindering the progress of the wound healing. Contohnya, patient with the extreme age, elderly patient, usually difficult to get good wound healing. Patient with uncontrolled diabetes, hypertension, with anemia, and also CKD pun difficult to have a good wound healing. Patient might has medication such as on chemotherapy, ataupun patient mungkin beli drugs over the counter yang ada high dose of steroids. Patient with the nutrition problem such as obesity and malnourished pun akan ada problem with the wound healing. So when we can identify the problem ataupun the systemic factors that can hinder the wound healing, it's our job to optimize the patient condition to attain good wound healing. Right. Okay. So our third steps adalah to implement local wound management. At this step, dia punya aim ataupun objective adalah for wound bed preparation. Okay. Ada 4 steps of local wound management. Okay, yang pertama adalah from your history and assessment, you have to establish the goal of treatment. First, you have to question yourself, is this wound able to heal? Maksudnya, adakah luka tu possible untuk sembuh atau tidak? What are the underlying causes? Is it treatable or not? Do we have sufficient resources? Barang-barang yang cukup untuk manage this wound? Contohnya adalah kalau patient yang ada malignant wound. breast cancer wound. Is it curative ataupun palliative? So this is the crucial steps. First adalah to establish the goal of treatment. Okay. Bila you dah ada you punya goal of treatment, only then you can educate and do a shared care with patient and also carer. We should explain to them about the situation of the wound and the reason why the wound failed to heal. And then subsequently, we have to discuss with them what are our future plan of care and what are the reason kenapa kita pilih that plan of care. And then from this, kita kena explain to patient what are their roles in managing their wound care. Contohnya, we have to educate them, emphasize them about the wound hygiene at home. Because dengan cara educational and social care ni, only then kita boleh dapat a good behavior from the patient that will promote the wound healing. Okay, and lastly, don't forget, it's our job juga to give them the emotional and also motivational support. Okay, and after that, come to the wound bed preparation. Dalam wound bed preparation ni, our goal is to create an optimal wound healing environment supaya luka itu dapat sembuh. Ada dua important component here. First is the wound assessment and number two is the time approach. Okay. Wound assessment, okay, ada 3 komponen penting. Yang pertama adalah to measure the size. Number 2 adalah the time assessment and the number 3 adalah the surrounding skin assessment. Okay, it's very important for us to know how to measure the wound properly. Okay, we have to measure the length head to toe at the longest point. Maksudnya kat sini, katakan wound ni bentuknya macam ni, dia mesti adalah, kalau panjang tu adalah A component and lebar dia adalah B. And don't forget about the C. Cara measure and documentation very important because only then you can see the progress of the wound. Okay, only then you will know wound ni progress dengan baik ataupun tidak. Okay. So the next step, setelah you measure, then you have to do the time assessment. This basically is a assessment regarding the tissue viability. Sama ada tissue tu sihat ataupun tidak sihat. Nombor 2, the presence of infection and inflammation based on symptom and also signs of the clinical of the patient and also the wound. Number 3 adalah moisture balance. And lastly, about the epidermal margin, is it advancing ataupun non-advancing? Okay. Basically, to make it easy, there's a 4 color coding. Bila kita tengok je wound, we have to see this 4. We have to assess this 4 color. Ada tak tisu mati? Tisu mati basically dia warna hitam dan juga warna kuning. The necrotic, okay, the necrosis and also the slough. Okay, the pink is the epithelialization, epithelial tissue, and the red beefy color is the good, healthy granulation tissue. Okay, so you have to assess and document. Okay, and then you have to check whether there's an advancing epidermal margin. Okay, inilah contohnya advancing epidermal margin. So you can see the wound become shallow. The wound age is very shallow, malah boleh katakan macam bersambung dengan dia punya wound bed. Okay, at the same time, untuk luka yang tidak ada advancing, you have to check with the presence of undermining and also tunneling. These 2 is very important for during your assessment, and also bila you nak document, you have to document using a clock format. So that in the future when you reassess balik the wound, you boleh check terus dekat kawasan tersebut ada improvement ataupun tidak, ataupun mungkin ada presence of the new tunneling of undermining yang menunjukkan the wound actually bertambah teruk. Okay. And then don't forget about the peri-wound. Peri-wound by definition adalah 4 cm from the wound edge. Okay, so ada banyak cara classification, but in Malaysia we can use the Hari Krishna peri-wound skin classification. Okay. And don't forget about the documentation. Documentation, again, I would like to emphasize it. It's not only to see the progress of the wound, but at the same time, it's for medical, legal purposes. We have to remember that not all wound berakhir dengan satu kesembuhan. Some of the wound sometimes ada very bad outcome. Contohnya mortality and also amputation. And wound adalah antara perkara yang paling highly associated with medical legal. So please prepare ourselves juga. Okay. So this time framework is very important sebab from the time assessment, you will you can make a clinical decision. What do you want to do with this wound? Okay. Alright. Okay. Contohnya from the tissue viability. Okay. You can see this wound penuh dengan yellow tissue. That means it's a slough. It's a bad tissue. From there, you have to decide. You want to use which part of debridement method untuk dapatkan wound bed preparation yang like this. So kalau staff saya, paramedic saya suka cakap seperti tembikat. Okay, alright. So kalau luka macam ni, you have to decide. Can we use sharp debridement? Ataupun we have to refer for surgical debridement? Ataupun actually sufficient untuk buat autolytic or enzymatic debridement? Kalau kita ada kepakaran untuk biological debridement such as maggots ataupun lintah, can we use that for our patient? Okay, so this is question that we should ask and we should discuss with patient apa yang debridement method that we want to do for this patient. Okay, number 2. Okay, assessment of the infection and inflammation. So dalam patient with ada chronic wound ni, okay, study menunjukkan 70% of them memang ada biofilm. Okay, basically biofilm ni adalah collection ataupun contamination of the bacteria on the wound surface. Okay, actually mana-mana surface pun memang ada contamination of bacteria. Okay, so tapi apabila bakteria tu, bila dia dah lama dekat situ, dia dah duduk berkawan-kawan, dia become colonization. Okay, masa dia colonization tu, dia rasa dah shock dah ni. Waktu ni, kalau you buat mechanical debridement, okay, mungkin ada harapan lagi. Masih boleh bantu lagi wound tu. Tapi bila katakan kita biarkan je, kita tak buat apa-apa intervention terhadap chronic wound ni, okay, lama-lama dia akan buat satu like a microcolonic formation bersama dengan dia punya koloni bakteria lain. Waktu ni dia akan panggil bakteria-bakteria lain untuk stay together macam dia dah buat like satu kawasan setinggan. Okay, pada waktu ni sangat difficult to manage the biofilm ataupun to buang the biofilm. Okay, so sebab kita tahu all the chronic wound memang ada high bioburden on biofilm. So we have to manage it, okay, to prevent the biofilm ini become infection. Okay, so kalaulah bila kita tengok patient tu, we have to decide, is it just a high bioburden or biofilm atau patient ni dah ada infection? Because based on your assessment, kita kena decide sama ada that wound need local antimicrobial yang mana kita boleh dapat daripada pelbagai jenis cleansing and also dressing, or this patient might need oral antibiotic, or ultimately mungkin perlukan referral to the tertiary hospital for parenteral antibiotic. Okay. So, okay, the third step is the moisture balance. Okay, untuk ada good wound healing, the wound must be moist. It cannot be too dry, it cannot like this, tak mau, and it cannot be too wet like this. Okay, yang ini dah ada maceration dah, maksudnya the wound very wet. Okay, the good wound dia will be very moist. Okay, dulu-dulu masa kita zaman dulu-dulu ada satu fahaman bahawa wound ni perlu dibiarkan terbuka, biarkan dia kering untuk dia sembuh. Tapi in 1960, this Josh Winter from his study, he found out that moist wound will accelerate wound healing. It will increase the epithelialization rate, it will increase the collagen, angiogenesis, and also it will decrease the pain to the patient. Okay. So from your moisture assessment, you have to choose apakah modern dressing ataupun any type of dressing that we can use to help the wound to achieve just a moist condition. Is it if the wound too wet, okay, terlalu basah, then kita perlukan modern dressing yang boleh absorb the exudate. If the wound too dry, then we have to provide the wound dengan dressing yang boleh donate water ataupun kelembapan kepada luka tersebut. Okay, and then we have to check for dia punya age. Okay, epithelialization advancement adalah apabila the area of the pink purple epithelium ni from the periphery of the wound, okay, dia akan advance ke dalam good granulation tissue ni. Okay, dia punya aim ataupun goal of epithelialization ni adalah untuk cover the wound bed dengan kulit baru. Okay. Bila luka tu ada non-advancing, okay, usually they have age effect, di mana epithelium tu gagal untuk cross the wound bed. Okay, so from there we have to check kenapa. Adakah that patient ada fibrous age macam ni kan, dia ada fibrous age. Ataupun dia ada rolled age ataupun callosity like this. Okay, ataupun mungkin dia ada roll age, sama ada roll up ataupun roll down. Okay, if the patient ada problem with the age of the wound, so we have to do wound refashioning. Okay, supaya luka itu boleh sembuh. And another factor adalah kalau tidak berlakunya wound advancing, maksudnya peripheral wound age punya advancing, you have to see the patient again. You have to plug the patient again, reassess the patient. Is there any factors yang menyebabkan delay wound healing? So, mungkin patient actually ada uncontrolled diabetic. Mungkin, like I say, mungkin patient ambil traditional treatment dan actually contain high steroid. Ataupun mungkin kita salah diagnosis. We thought it's DFU, diabetic foot ulcer. Tapi sebenarnya patient ada venous ulcer. And patient yang ada venous ulcer, managementnya seperti kita tahu adalah different. Okay. So, the first step adalah now we have to choose, okay, what are the modern dressing that we can use for this patient. So, the aim of the dressing adalah to facilitate wound healing. Itu aim dia. So, dressing ni akan cover the wound from the trauma and pathogen. It also will prevent and treat infection. Some of the dressing boleh promote ataupun do ongoing debridement like an autolytic or enzymatic. They're also important for moisture balance and lastly to promote the granulation. Okay. Conventionally, dulu we use gauze, tool dressing such as petitgrass, jellonet and also bandage as a primary ataupun secondary dressing. Okay. The aim at that time just to cover the wound and to manage the exudate. Okay. And to use this is okay untuk wound yang clean ataupun wound yang ada mild exudate level. Tapi from our experience and studies, we noticed that the conventional dressing ni, their problem is they are failed to provide a moist wound environment for that wound. So with the advanced technology, this conventional dressing dah replaced by the modern dressing to support better wound healing for our patient. Okay. There are many products in the market that can help us to give the best dressing kepada patient. Okay, we have a cleansing solution yang ada antimicrobial. Okay, we have antimicrobial like iodosol. We have products with silver like cadmium and cavida. Okay, We have dressing like aquacel, Caltostat, and also some of the special foam dressing that would help us to manage the wet wound. And we also have um, honey that can do enzymatic debridement. And we also have biofil, which is a collagen that can promote granulation in a wound that very difficult to heal. Okay, so how can we choose all this? Kita boleh manage, kita boleh decide based on our wound assessment. Okay, to teach you, to share how to choose this dressing is another big topic. Alright. Okay. So after, kita dah dapat etiology diagnosis, kita dah identify risk factor, kita dah buat local wound management. Now we have to go for the specific management because some of the ulcer tak cukup setakat dressing. It need more than that to provide good wound healing. Okay. As example, patient with diabetic foot ulcer. Diagnosis DFU sahaja tak cukup. We have to know what are the underlying pathology yang menyebabkan patient develop DFU. Is it neuropathic ulcer? Is it ischemic ulcer like this? Or is it a combination of neuroischemic? Okay. And then patient with diabetic foot ulcer, don't forget, aside from the wound management, diabetic control, we have to check whether the patient ada adequate vascular supply. Okay, if they have ischemia without good vascular supply, tak ada good angiogenesis, okay, patient tak boleh nak dapat good wound healing. We have to control the infection because we know that DFU associated, memang banyak DFU yang dapat hard to heal wound. So all these wound are high risk and very high potential to get wound infection. So we have to control dari awal. And then don't forget about the offloading, especially patient with Charcot neuropathy. Offloading ni sangat penting in patient with DFU. Kalau patient tu ada neuropathy ulcer, kita tak buat offloading, okay, dekat kawasan yang ada high pressure tu, maka the wound takkan sembuh. Okay, there are many types of offloading. Bergantunglah dengan kita punya discussion dengan patient and apakah resources yang kita ada and also financial kemampuan yang kita boleh, kemampuan yang patient and also kita ada. Okay, but this is all doable. Kalau kita tak ada in primary care, what we can do adalah we can refer the patient to the hospital. We can discuss with our occupational therapist for the offloading. And kita pun boleh refer our patient to Zakat or Baitulmal untuk special shoes yang ada offloading. Then how about venous leg ulcer? Untuk venous leg ulcer, dia punya gold standard treatment adalah compression bandage. Kerana compression bandage ni akan reduce the pressure in the venous system, menyebabkan kaki tu kurang bengkak, tidak bengkak dan akhirnya menyebabkan berlakunya penyembuhan luka. So, patient yang ada venous leg ulcer tanpa compression therapy usually very difficult to heal. So, don't forget to check the ABSI, okay, to see whether this patient as a screening to see whether this patient ada arterial disease atau tidak. Because we know that one of the contraindication for the compression therapy adalah patient yang ada concomitant arterial disease. Okay, so patient with the venous leg ulcer, okay, apart from the not compression stocking, compression bandage yang kita boleh buat dekat primary care, usually the 2 layer. Okay, we have to manage dia punya underlying problem, usually the obesity. Okay, the weight management, we have to discuss about the exercise. And usually patient yang ada VLU, they have a skin problem. So we have to manage the skin also. Otherwise, the patient akan dapat new ulcer dekat tempat lain. Okay, and then patient should be referred to surgical ataupun vascular team so that they can do the duplex scan to determine what are the causes of the venous ulcer. And from there, they can decide sama ada any therapy or any treatment can be given to the patient. Okay, otherwise it's like a vicious cycle. Kaki tu akan terus bengkak tanpa proper treatment. Okay, and patient with pressure injury. Okay, setakat management of the wound bed tak cukup. we have to educate the patient and also the family members about the repositioning. Okay, so to redistribute the pressure over the bony prominence and area yang ada high pressure. Okay. Apart from that, our patient yang ada pressure injury ni usually are pet pump patient. So we have to assess dia punya nutrition status, and then they might need special food, special meal replacement to increase the protein and calories. We should incorporate our MDT, patient dengan yang ada pressure injury ni, kita patut involve sekali our dietitian, our OT, our physio, okay? And then we have to advise the patient and also the family members about the support services so that it will reduce the risk of pressure injury. Don't forget to treat juga to prevent if there any moisture associated skin damage. Contohnya patient yang ada incontinence, sama ada fecal ataupun urine incontinence, because high moisture punya skin memang associated with high risk untuk dapat pressure injury. Okay, sometimes untuk patient yang ada, bukan sometimes, when patient ada high risk untuk dapat pressure injury, contohnya bedbound patient, we have to do pressure risk assessment for them to decide whether that patient dalam golongan yang high risk to get the pressure injury ataupun low risk. From there, barulah kita boleh buat treatment plans to treat the current ulcer, okay, and also to prevent the new pressure injury. Okay, and lastly about the arterial ulcer. Patient yang ada arterial ulcer usually they develop spontaneous gangrene or ischemic ulcer dekat toes ataupun lateral border of the foot. So don't forget to palpate the DPA and also PTA. Is it weak? Is it absent? Or is it normal? Okay. Kalau normal pun possible ya untuk patient dapat arterial ulcer. And then do the ABSI to check the severity the ischemia. If you have the Doppler probe lah. Okay. This is to just to check for the severity ischemia. It's not to confirm. So regardless kalau ABSI tu normal pun, but clinically, okay, and also from your assessment you rasa is arterial ulcer, you still have to refer the patient to vascular team. Okay, they will do the CT angiogram and sometimes they will proceed with revascularization so that the patient boleh dapat good wound healing. And don't forget to optimize all other medical condition. Okay. Bila kita dah buat holistic wound care ni, okay, bila kita lihat patient in primary care, kita tak boleh tengok patient dia punya physical sahaja. We have to think also other contributing factors that could delay the wound healing. Contohnya, macam patient, mungkin dia the breadwinner ada family, okay, kerana dia ada neuropathic ulcer dekat plantar, dia tak boleh bekerja. Okay, emotional dia mungkin terganggu. Bila ditanya actually dia ada depression, dia ada anxiety. So you have to treat that. Okay, dia mungkin ada masalah financial. Okay, mungkin selepas tu dia rasa dia tidak dapat perform dia punya tugas sebagai ketua keluarga, sebagai suami. Okay, so you have to assess and address all this issue with the patient. Of course lah, the first visit bila you jumpa patient, 1-2 visit tu you tak dapat all this history. Patient-patient kita dekat primary care, selalunya yang kronik ni, akan jumpa kita banyak kali. So take that opportunity untuk assess all this component from the patient. Remember to treat the patient as a whole, not only the hole in the patient. Okay. Bila kita dah ada holistic care plan ni, don't forget about the patient-centered care. Okay. Patient-centered care ni bermaksud kita dah ada plan, kita kena develop a partnership between wound care team dengan patient. Okay. Because patient ni, setiap patient different. Setiap patient unique. Tak sama cara kita treat them. So, kena kenali patient anda. And study dah menunjukkan patient yang actively involved dengan dia punya treatment plan, they will have a better outcome. Okay. So as a conclusion, these are the fundamental of wound care management in primary care. First, to establish the diagnosis ataupun the wound etiology so that you can treat the patient according to the diagnosis. Number two, identify and correct all the risk factors that can prevent or delay the wound healing. Number three, do the wound assessment and documentation. And subsequently from there, please choose the cost-effective wound dressing for that patient. And lastly, don't forget the holistic and also patient-centered care. With that, thank you.
Thank you, Dr. Shima. Can you read the question in the Q&A column?
Q&A. Okay,
Yeah.
all right.
Okay.
All right.
So maybe you can answer the questions.
Okay.
Alright.
Okay. Soalan from Tai Imsing. Hi, Dr. Shima. Is there any role of sending wound swab CNS if suspected infection? Yes. We have to send wound swab CNS in a case. It's not only a wound that you suspect infection, in a chronic wound or in a wound that you tak nampak the progress of the wound healing pun you have to send. But you have to send the sample properly. There are special technique to send the wound swab CNS, which is called Levin technique. Okay, all right. Honey dressing suitable which type of wound? Actually, any kind of wound pun boleh for honey dressing. Honey dressing dia ada few roles in wound. Okay, first the enzymatic debridement. That's mean in a wound yang ada slough, okay, necrotic, dia boleh lembutkan and easier for you to do debridement. Okay, number one. Dia pun ada antimicrobial property. And also lastly, dia pun honey dressing also adalah can promote granulation tissue. Okay, so semua boleh sebenarnya kecuali in a patient yang ada allergic to the honey ataupun patient yang ada pain. Usually honey associated dengan pain. So you kena tanya juga. You kena tengok sama ada patient boleh tahan or not with the honey dressing. Okay. And satu lagi adalah kalau patient tu terlalu exudative wound. Because honey ni dia akan menyebabkan the wound become more exudative. So kalau you nak guna juga, you have to use good barrier cream at the peri wound and also good secondary dressing. Okay.
Dr. Shima, let me read the question for you. So the next question is, would you recommend doing wound swab during recovery phase of chronic wound? If not, because it's already contaminated, how to monitor if the wound is healing properly and not infected? So
Okay.
would it based on appearance and symptoms?
Okay, it must be all together. As I said, the chronic wound atau hard to heal wound, 70% got biofilm. But this biofilm doesn't mean that you need to treat. Okay, mungkin sufficient with the local antimicrobial. The one that you need to treat with the antibiotic adalah the one with the local infection ataupun systemic infection. Okay, routinely to do swab at the recovery phase for the chronic wound depends. For me, kalau the wound memang stuck, okay, then you have to do. Kalau tak, kalau dia progress, then tak nak buat pun tak apa. But if you want to do, you have to know how to do it properly. Otherwise, you takkan dapat benefit from the swab CNS. Okay, okay. If not, okay, the wound already contaminated. That's why again, you have to know how to do it properly. What are the technique? Usually the technique nama dia Levin's technique. Nanti you boleh Google. Okay. No hydroxin solution for dressing which is suitable for adenoma. Okay, hydroxin ni adalah antimicrobial. So kalau wound yang ada, you suspect ada biofilm, yang ada apa ni, yang need the antimicrobial solution, you pakai boleh. Tapi kalau wound yang saya galakkan pakai sterile water rather than normal saline. Okay, so kalau you tengok dalam garis panduan lokal, wound yang type 1 to 1, 2, 3, yes, you can use sterile water. Maksudnya wound that tissue viability dia more than 35%, tak ada infection, dia punya tak ada some sort of infection, so you can use sterile water. Okay.
Okay, next
What
question.
is the Okay, what is the best solution to use for multiple abrasion wound post MVA? Flavin, hydroxine, and what secondary dressing use? Foam because usually B abrasion is wet and moist. Okay, back. Okay, again, soalan ni what dressing you want to choose adalah based on your assessment. Multiple abrasion post MVA. If it's okay, first you have to clean the wound. Okay, because the abrasion from the MVA kan, you have to clean wound. So you can irrigate the wound with sterile water, no problem. Okay, and then kalau you rasa dia high risk untuk dapat infection, then you can use antimicrobial. Okay, antimicrobial solution banyak je. You boleh pakai Carbidopa, lychee pun boleh. Okay, and then kalau you kata you nak guna foam, kalau you ada foam, oh yeah, why not? Boleh pakai juga foam. First, dia will retain the moist. Number 2 adalah dia tak melekat pada wound bed. So, it's easier for you to remove during you punya subsequent dressing. Okay. Flavin boleh, tak ada masalah juga. Flavin adalah part of iodine. Tapi flavin untuk jangka masa panjang saya tak galakkan. Because dia pun menyebabkan the wound dry. Remember, we want the wound to be moist to achieve good wound healing. With patient with chronic wound, large exposure of wound, the wound heavy exuded plus lah. Is it encouraged for BD dressing? Okay. Dalam konsep wound healing ni, kita tak galakkan kita promote dressing macam ni, kita tak berapa galakkan frequent dressing sebab every time you do dressing, that means you kacau the wound healing process. When we do dressing, usually the wound won't heal about 8 to 12 hours macam tu. Okay, so kalau that's why wujudnya modern dressing. However, in some circumstances, wound that heavily infected, we might need do daily dressing. Contohnya, kalau patient yang heavily infected wound, at that time mungkin you perlu guna conventional dressing such as povidone dressing, povidone pad dressing. So kalau you use povidone pad dressing, you need to do it daily dressing. BD dressing I dah tak buat dah sekarang. At least povidone daily dressing is enough. Okay, so tomorrow you reassess balik the patient. Okay. Bila nak start antibiotic and for how long? Okay, yang ini depends on the patient from your assessment. Tadilah time assessment. Kalau clinically menunjukkan dia ada infection, okay, sama ada overt ataupun spreading of infection. From there, you kena decide lah. Maybe with that also you can assess juga patient punya white cell count, patient punya, kalau clinically patient mungkin rasa, selalu ni patient akan complain increasing pain. Selalu ni tak sakit, dia makin sakit. Ada fever, ada chest rigor, in elderly mungkin poor appetite. So these all are the subtle signs of infection. Desiccation adalah kering. Okay, the wound age tu kering. Maceration adalah basah. Okay, maksudnya tisu, bila, kalau bayangkan kita punya tangan ni, kita mandi mandi dekat sungai kan, bila terlalu lama dia kecut kan, that is maceration. Desiccation adalah kering. Okay. Is that so you suggest to go further? Okay. In Malaysia, we have under MSWCP, okay, Malaysian Society Wound Care Practitioner. They have a 6-month course yang is a good introductory course untuk wound healing. Okay, you can Google it. Okay. Can we treat osteomyelitis in primary care? My answer is no. Okay, the best is you have to refer to the hospital. You have to refer to the auto for their expert assessment and management. After that, mungkin kita ada combined care. Okay, MPWT ni another chapter. It's a big chapter. I don't think we can discuss here. But basically, dia adalah wound yang adalah another advanced, bukan modern lah, advanced dressing that can expedite wound healing. This is very good. Is it in hospital available in primary care? Yes, we can use in primary care. Okay, cuma itulah the cost kadang-kadang. It's available. Okay. Do all wound require dressing? Or at times best to leave exposed. Kalau by principle, all wounds should be closed to attain moist wound healing and also to protect the wound itself. The overgranulating wound, okay, first usually the overgranulating wound ni associated dengan infection selalunya. There's an ongoing infection. So, this ongoing infection mungkin dia dalam contamination ataupun colonization ataupun subtle infection sebenarnya. Di bawah subtle infection. So, my recommendation adalah first you have to trim the overgranulating wound. Because the overgranulating wound ni, dia punya tissue adalah unhealthy tissue. Dia tak banyak blood vessels. But you can only do that if you're skilled enough. That means you are trained to do it. Okay. So the best adalah actually prevention lah. Okay. It's not treatment sebenarnya. Okay. Kalau you are good enough, you are trained, you can trim the overgranulating. Okay. To stop, prevent infection, prevent inflammation. Okay. Soalan Muhammad Yusof, I have a patient with chronic leg ulcer which is non-healing despite all measure. My answer is reassess the patient. Okay, take a good history, good examination of the patient, relevant investigation, wound assessment, rough the diagnosis, only then you can plan. Can we get a copy of the presentation? Inshallah. Okay. Hyperbaric, hyperbaric oxygen actually is another advanced therapy whereby it encourage angiogenesis. It will improve the blood flow to the wound. So of course lah, the good blood flow, it will bring all the growth factor that will promote wound healing. Okay. Mebo ointment untuk wound. Okay. Yang ini Mebo ointment untuk wound. Okay. Mebo ni actually dia daripada apa tu? Alamak, I lupa. Sesame. Okay. Dia menggunakan konsep, sebenarnya konsep dia to provide moist wound healing juga. Okay. That is dia punya core principle dia. Cuma in Mebo, you kena regularly apply on the wound. So kalau wound tu painful kan, regularly means at least daily ataupun BD. Okay, so kalau you wound is painful, so takkan you nak pakai Mebo. Okay, depends. Kalau wound mungkin yang dah nak baik, type 1, type 2, yes, you can use Mebo. Tapi kalau yang ada type 3, type 4, 5, 6, okay, yang need more to control the exudate, to control the infection of inflammation, maybe you have to use other types of dressing. Is there any specific guideline on how frequent we do dressing? There's no specific guideline. Okay. Kalau nak cakap specific guideline tak ada, but from your assessment. Okay. Usually infected wound, you macam I cakap lah, heavily infected wound, you boleh buat daily dressing. Ataupun very highly exudative wound, you boleh buat daily dressing, tak ada masalah. Tapi why? You have to know why. Why is it exudative? You have to tackle the reason kenapa dia heavily exudative. If it's infection, tackle the infection. If it's because of the venous ulcer, you have to do the compression bandage. Okay. So Yusof, this patient might need to be referred lah. Okay. Yes, you can debride the ages kalau ada in a non-advancing wound. Okay, actually you have to debride the age. But again, depends on you punya skill. Okay, don't forget to take the consent. Okay. Sodium chloride, okay, irrigation solution suitable for diabetic wound. Sebenarnya, it's not 100% contraindicated. Okay, it's just that dia, suitable for diabetic. But studies have shown that the sodium component will associated with microbial proliferation. Tetapi nak kata 100% contraindication tidak. But in a current situation, kita ada banyak solution ataupun cleansing solution that available. So my recommendation adalah to stay away from the normal saline. Okay, use the water for irrigation. Kalau tak ada water for irrigation, you can use mineral water pun boleh. How to get CBD point? Nanti penganjur akan menjawab lah. Okay, cukup ke nak jawab lagi ke? Dah 9:20.
Maybe boleh pilih beberapa lah kot. 1-2 lagi ke?
Okay. Okay, in case of sacral bed sore, how to prevent the wound committed with stools atau urine? Kalau dia pegang bebas. Okay, first adalah you kena ada good secondary dressing for the pressure ulcer, pressure injury tu. So good secondary tu maksudnya mungkin from my practice, usually kita akan letak foam and then mungkin kita boleh letak another layer like a film dressing. Okay. For the stools and urine, then you can have mungkin patient need CBD, okay? Ataupun kalau stools, kalau dia ada high watery stool, okay? Ataupun dia punya frequency increase, then patient mungkin required anal rectal plug. Okay, tapi it's expensive lah. Memang this one memang very challenging for us to manage, but there are certain ways lah. Okay. Hydrogen therapy. Pressure injury wound. Yes, boleh. Hyperbaric. Chronic wound with lymphedema. Okay, usually this one is not in primary care. Okay, kita support untuk wound dressing for this patient, but then this patient usually kita kena co-manage dengan vascular team. They will reassess what the reason for the lymphedema, and some of the patient perlu sometimes kena buat lymphatic channel punya operation lah. Okay.
Dr. Shima, probably one last question. So I'll just read the question for you. So the last question here, shall we refer to wound clinic at hospital for compression dressing for venous ulcer? Is it available at Klinik Kesihatan?
Okay, is it available in Klinik Kesihatan? If you mean, yes, some of the Klinik Kesihatan available, ada compression therapy. Okay, kalau tak ada, the Klinik Kesihatan will discuss with the patient. Sama ada patient willing to buy, this is one option. Another one is we can refer the patient to get bantuan keuangan, financial aid, maybe from the zakat or Baitumal, or we can also refer to the NGO. Ada juga yang I refer to NGO. And if you want to refer to the hospital, okay, to the wound hospital, definitely can, boleh. Cuma some of the wound hospital ni, wound team dia, you need to refer to the primary team dulu. So I think the best is to liaise with your respective wound care coordinator from that hospital, discuss with them where you should refer that patient. Is it direct to the wound team ataupun to the primary team, which is surgical lah in this case because it's a venous ulcer. Alright.
Okay, Dr. Shima, someone is actually asking for your email. So is it possible to get Dr. Shima's email so that we can invite for a CME or talk?
Boleh, my email drshima.suhaili@gmail.com.
drshima.suhaili
@gmail.com.
@gmail.com. Okey, kejap ya. Okay, so thank you everyone. for attending this session, and a special thanks to Dr. Shima for willing to share with us your knowledge today.
My
I hope
pleasure.
everyone can complete the link for the attendance. Please make sure that you put the correct email address. Okay.
All right.
So thank you everyone.
Thank you everyone. Hopefully semua orang
Terima
dapat
kasih, Pak.
kebaikan from this training session. Okay.
Alright. Thank you. Assalamualaikum. Good night.
Waalaikumsalam. Good night. Boleh nampak ke?
Boleh?
Okay, Alhamdulillah. Okay, so tajuk yang diberikan pada saya pada malam ni adalah Optimizing Wound Healing, Essential Techniques for Primary Care Practitioner. Okay,